Welcome to the Caregiver Relief Podcast. I'm your host, Diane Carbo, registered nurse, and today we're diving into a critical and very overlooked topic, aging in the LGBTQIA plus community. Our episode, Unseen and Underserved, explores the unique challenges faced by the LGBTQIA plus older adults, from navigating discrimination in healthcare and long-term care settings to dealing with social isolation and the absence of family support networks. Joining me today is Dr. KaRon Spriggs-Bethea, a licensed clinical social worker, professor, and founder of Let's Talk Solutions. KaRon is dedicated to creating safe, affirming spaces for individuals from all walks of life and is a passionate advocate for the LGBTQIA rights. He brings both professional expertise and deep compassion to this important conversation. Together, we'll explore the barriers that elders face in the LGBTQIA plus community, the resilience of this community, and how caregivers, allies, and professionals can create more inclusion, supportive environments for all. This episode is sponsored by myvitalvault.net, your all-in-one life organizer for aging adults and caregivers. It's designed to help you securely store your essential legal, medical, and emergency information in one easy-to-access place. Because when a crisis hits, being prepared can make all the difference. Join our Caregiver Relief community, a warm, welcoming space where you can connect with other caregivers, ask questions, share stories, and find support from people who truly understand. Visit community.caregiverrelief.com to join now, because caregiving is one of the hardest and most meaningful things you'll ever do, and no one should have to do it alone. And if this episode speaks to you, please take a moment to like, share, or comment. Every click helps us reach more caregivers who need encouragement, resources, and hope. So let's get started. KaRon, thank you for joining me today. These are really heavy topics we're going to discuss. But before we do that, I was hoping you'd share a little bit about your journey into social work and what inspired you to focus on creating safe spaces for marginalized communities.
Yeah, absolutely. First of all, thank you so much for having me and having me on the show. So, yeah, a little bit about myself and what got me into social work. I fell into this. I originally was going to go for political science. I was in some political science classes, was going to go to law school, all of that. And then I took a class and I was like, this is definitely not for me. And so I started taking psychology classes and got into that, took some sociology classes and got into that. And in my senior year of undergrad, I talked with my advisor and you should check out social work. I think you would be good in that. And I went to a open house here at Pitt and loved it and fell in love with the program and decided that's what I was going to do. And I honestly, the rest is this history. And I really love that I was able to do that because one, social work, you can do so much with that. There's so many things that you can do within social work. It's not just therapy, it's not just child welfare, adult protective services. It's so many things that we can do to
Yes.
make a difference in someone's life. And I wanted to be the person that I may not have had growing up. Like my family was very supportive and all of that, but I didn't have people that I thought were like me. So being part of the LGBTQI plus community, I wanted to find someone that I could look up to. And I didn't have that growing up. And so I going into social work and going into the work that I do, that's what I want to be for other people. And that's what got me into being and working with marginalized populations, specifically within the LGBTQI plus community.
How do issues like discrimination and stigma show up differently for LGBTQIA plus elders compared to younger generations?
So there's a lot of things that show up. So we may see things like ageism and the ways that people treat older adults, and there's sometimes this infantilization of older adults, which is very discriminating. We also want to think about that intersectionality of different identities. So as you were talking about the LGBTQI plus older adults, they're going to experience things like social isolation and healthcare disparities because there's not a lot of people out there that may understand what the intersections are and what these things are that these individuals might be experiencing at that time. And so when it comes to looking at how older adults, LGBT older adults, and younger adults may experience different stigmas and biases and discrimination, things like that, it really comes down to things like systemic barriers and again that idea of ageism, ableism, all of those, a lot of those isms are going to show up that we may already know about and we already hear, but I don't want to say there's not differences, but it shows up a lot of the same things within across populations and across ages as well.
Yeah.
But like I said, I think it's a lot of the ageism and ableism that's going to show up in the older adult population.
So, from your perspective, what are some of the biggest challenges that LGBTQIA plus individuals face as they age?
I think that there's the ideas of, like I was saying earlier, the social isolation.
Yeah.
People may be passing away in their lives. They're losing relationships. They're losing people in their lives, living alone, potentially being put in homes to be cared for. I think that there's also aspects of the healthcare disparities and not having enough people that are culturally competent in the ways that individuals within the LGBTQIA plus community and older adults are able to work in what they're experiencing. What
I've
else?
been a nurse for over 54 years.
Okay.
And I want to tell you that what I saw, I've been through the AIDS crisis.
Yeah.
I started as a nurse in 1971, going to school in West Penn, as I
Hmm.
told you. And what I saw and I witnessed with the community, the LGBTQIA community, is even our healthcare professionals are lacking in caring or knowledge. I see it all the time. In fact, I worked as a PRN nurse when my
Okay.
kids were young. Okay, that meant I call in and say, hey, I can work this day, this shift, and if you need me, call me and I'll come in.
Yeah.
And and I wasn't through agency; I was within the hospital, but we always were assigned the worst patients on the floor that the regular staff didn't want. And
Gotcha.
so I often got the AIDS patients. And I have such fond memories of some of these patients because of what they went through. And I saw that the lack of family support, the lack of the
Yes.
caring staff, actually. Everybody,
Yes.
people were as terrified of AIDS as they were of COVID, and
Yeah.
the miscommunication and stuff with and miss all that was way it was made to be worse than it was, and people had so much anger towards the community because they thought they brought it on themselves, and it was just ugly. But I can tell you that what I did see with the community is the community came together. And I saw the LGBTQIA plus older adults, or even, and because many were young, with the
Yeah.
parents.
At that point. Yeah.
Yeah, they were showing up and they were visiting and connecting. And one patient that I took care of just touched my heart. He was a dentist from San Francisco that was returning home to die. He was blind, had no short-term memory, and he would record everything we said so that he could go back and remember it. And my my patients have always told me, even if I can't see you, I hear you because they hear me laugh.
Yes.
And
Yeah.
he looked forward to me coming because I did have that interaction where I wasn't afraid to touch him. I wasn't afraid to talk to him. I wasn't afraid. And I think he found that refreshing.
Yeah.
And nowadays we have many in the LGBTQIA plus older adults don't have traditional family support at all. And it impacts their emotional and physical well-being so much. I have several married gay couples that their families have totally distanced themselves from them
Mhm.
because
Yep.
they thought they were living in sin. And
Yes.
I, I have to tell you, I have many friends, and I'm sometimes jealous of and envious of the gay community relationships because they seem to have a better relationships because maybe what they went through than some heterosexual couples. I'll just come right out and say it. Can you tell me of some examples of barriers that these LGBTQIA plus elders encounter in healthcare or in long-term care facilities?
I think going back to what you were just talking about of not having providers that are willing to, in this case, the people with HIV and AIDS, like not wanting to touch them or anything like
Yeah.
that. So I think that's a big thing is not having people that are informed of
Yeah.
what that looks like, but also informed in that regard of people are people.
Exactly.
Just because they identify LGBTQI plus doesn't mean they're not a person. And so yes, we all have unique aspects that we
Yeah.
come in with and we need to express, but we need to be able to have providers that are willing to listen, willing to be open to have those conversations. I know there's been some situations where someone has gone into the hospital or they've gone into a care facility and they're not the facility or the hospital isn't open to having the conversations of what family looks like. Who is your family? It can like it, chosen family is huge. And so not understanding what that looks like can be a huge barrier to treatment and to people talking to their providers about certain things and being willing and open to have those conversations because oh, you're not going to recognize that this person is either my partner or this person is what I consider to be family. And I think that's a big going to be a big part of it is learning what those things are.
I
And
agree. You know what? It shocked me because I thought we were further along in our culture that I've had gay clients, that's a dog, sorry, that were married or before gays were permitted to be married, according to in the law,
mhm,
that their spouse or their partner wasn't allowed in to visit them or
yeah,
because it wasn't included as family. And that just makes me sad that you have this relationship with somebody and it's the healthcare system ignores it.
mhm,
I've seen it in
mhm.
nursing homes too, where
Absolutely.
yes, they've actually had to hide their relationship because it wasn't accepted
Yeah,
in the nursing home community. And I'm like, oh my, that's terrible because we are all people. We all
we are
want to
all
be loved. We all want to be touched. We all want to be acknowledged. And to take something like that away, especially at a time when you're declining or not
mhm,
unwell, it just mentally, physically challenges your whole being.
Yep. It does. It does. And I think that could be a huge barrier too, is that if we are having to hide things or have to live in this isolation, that can take a toll on our mental and physical health.
Yeah.
And not being able, like, there was a documentary that I would show my students, and I cannot remember the name of it, but it was this conversation exactly of
Mm,
what is going on, what happens when people, LGBTQI plus older adults, go into care facilities in particular,
yeah.
and how they have to go back into the closet because they don't feel safe or they can't feel cared for in those places and live authentically themselves
Yes.
because they're not sure what's going to come out of that or how they're going to be treated in those facilities.
Yes. It really truly shocked me because one of my very first patients as a student nurse was a man who was transitioning to be a woman. And I found him fascinating because it was my first interaction. Here I am, 17 years old, and I knew nothing about it. And it was just fascinating me to learn. And we had interesting conversations. So I didn't find, and I was raised Catholic, but I did not find him to be offensive. I did not find him to be anything but trying to, he would call his mother every day and talk to her, and she would, at least she loved him. That
Hmm.
was really important because so many their parents just disown them, and which I don't understand how you could disown your child. But so I guess I've been more open all my life about it. So I was shocked. And I have, in healthcare, you can't help but have gay friends. You just can't, because it's a caring profession. And
Hmm.
along with that are people that are providing care that are closed-minded, bigoted, and against anything that is out of what they consider norm in our, and it's frightening because you don't know how you're going to be treated. I know in my
Right.
situation, it was in a Philadelphia commute home, nursing home, where the patient was dropped intentionally, and the patient, he was part of the LGBTQIA elders, and he was given cold showers. They were cruel to him. And I was shocked. Of course, here I am. I discovered this while I was making rounds, and I'm the outside
Okay.
nurse.
Yeah.
And
Yeah.
when I brought it up to the facility, I reported it. I was never allowed to return to that facility. That shocked me
Yeah.
because there was such abuse going on. And I know that it's going on today. And that's why I thought it was so important we have this conversation.
Absolutely.
Social isolation is a huge concern
Mhm.
for
Mhm.
this aging population, but it's even more intense for the LGBTQIA plus elders. What other factors contribute to that?
To social isolation.
Social isolation, yeah.
I think that there's levels of, yeah, there may be individuals that may not have children. So
Yeah.
because they don't have children, there's not there's not that support there. As you talked about, the family system,
Yes.
there's not that biological family system. There may be some chosen family that they have, but again, if they've grown up together and all the people that they've surrounded themselves are all elders, they may
Mhm.
be losing them to death, to sickness, to these other aspects, or they're going into these care facilities and potentially losing touch with the people that they may have had interactions with outside of that facility, may be likely to live alone as well and not feel comfortable with going out or meeting other people or anything like that. So I think that plays a huge role in the ways that social isolation are
Yeah.
seen in this population.
I have a very dear friend her partner passed, and the past 4 years, it was before COVID, then she went
Okay.
through COVID, and she's terribly lonely, but she's afraid to go out into the community because we're down south here, and she's afraid of being judged
Mm,
or
yeah.
um, in some way. And I feel bad because I can't help her to get out. I've given her some ideas and places to go. And even I have some gay friends that said, "Oh, we do trivia, come and have her
Mhm.
come," where she would feel very safe in that community. And it's just this getting over that fear. And she was a
It
healthcare professional, and
Okay.
she knows what went on in the hospitals and stuff. So she has that
Yeah.
fear. And it's really sad because, again, her family has disowned her, and she never had children. And it's very isolating.
Yeah. And something I want to add to this too is stigma. Stigma plays
Yeah.
a huge role in this. So this stigma that older adults or stereotypes, anything like that, that older adults are not attractive or why are they out there, excuse me, why are they out here doing these things
Yep.
and things like that, that can contribute to that social isolation. I don't want to
Yeah.
go out and just like your friend, I don't want to go out and put myself out there because I don't know what is waiting for me out there. Even
Yes.
though there might
Yes.
be people that she can connect with,
Yes.
that
Yeah.
fear of being judged and being stigmatized in the community, outside of
Uh-huh.
the community, is
Yeah.
what keeps people in fear and will continue to isolate.
Yes, and that's what I see with her and many others that have lost a spouse, a
Mm,
partner, and the isolation. One of the things my listeners may not realize that depression and suicide in people over the age of
mm,
65
mm.
is the second highest level
Yes.
of suicide attempts under the veterans that commit suicide
Yep.
22 a day. And we're getting there. And a lot of it has to do, I'm sure that community, the LGBTQIA adults, are a large part of that because they are so socially isolated. And as anybody that grows older, I'm 72 and I already have family members, siblings. I lost a son. We lose our friends as we get older.
Yeah.
And
Yeah.
you get your circle of friends gets smaller and smaller, and not everybody in the LGBTQIA elders community has a big circle anyway.
Right.
So
Right.
one loss is really,
Can
uh,
make a huge difference.
yes. So how can caregivers and allies help address loneliness and foster community for these adults?
Yeah, so I think a big part of it is we as caregivers, as helping professionals, we can try to foster and bring people together. Can we do some groups? Can we provide some safe space that could be in a care home or a community center or anything like that? What does that look like? Or like for me, I'm a therapist, so I could put together a group that focuses on social skills and things like that for LGBTQIA plus older adults. I think that the other thing that we have to think about is accessibility. How can we're in a time where technology, telehealth, things like that are huge. Yes, it makes things more accessible for people, but sometimes older adults generally may not know how to use technology in
100%.
a way that
Yep.
is
Yep.
beneficial for them. And
Yes.
so that can be a huge barrier. So can we create these spaces where, yes, maybe we do something online, but what does it look like for us to be able to help people find those things online and provide that space? I think it's also just building community with people. Connect like what you were trying to do with your friends.
Yeah.
I know some people. Would you like to meet them? It's
Yeah.
not so much like I'm setting you up with
No,
someone.
no, I wasn't trying to do that
I
at all. Yeah.
I know some people that you want to get out. they do some things that could help you feel more comfortable getting out. And I trust these people as well.
Yes.
So we can use our natural supports to help build that community with clients as well, or with just people in general as well.
What I've learned from the LGBTQIA plus community, not just the elders, but their youth, is despite the challenges, they are incredibly resilient.
Mm,
Saw it during the
mm.
AIDS crisis. I saw at a time when we seriously lack a sense of community in our society anymore. The nuclear family and all the extended family members are not living within a 25 to 50-mile
Mm.
radius of where they were born. Now we're living all over the world and
Yeah.
in different states and stuff. So we've lost our sense of community, and it's really sad, and it's impacting how we're aging, not just for the community, the LGBTQIA plus elders, but for seniors in general. It's terribly lonely. There's a lot of ageism out there.
Yes.
Can you
Yes.
share examples of strengths or coping strategies you've seen in your work in your community?
So I think that let's see, some coping strategies that we could use or that has worked.
Okay. One of the things that I see with the coping strategies is they don't, for the most part, I know as you get older, because I feel it too, you get tired and from challenges in life and you just don't
Mm,
want to get up all the time.
mm,
What I see with your community that I don't always see in other communities is there's a lot of support until for them in if they stay connected, but it's losing that connection that's really hard. And I always encourage approach aging and with self-advocacy, but I
mm.
find that with the LGBTQIA plus elders, they have a hard time feeling safe advocating for themselves.
Yeah.
Do you
Yeah.
find that as well?
And yes, and I think that can be indicative of a lot of marginalized populations as well. And I I think that it has to do with I think it I don't want to say has to do with. I think it depends on where someone is,
Okay.
geographically,
Yes.
especially, and like physically, where are they? Are they in a hospital? Are they in a nursing facility? Are they in their own community in a rural area? Anything like that? Because one, they may not know what's even available.
Yes.
Two, it may be that, yeah, I just don't feel safe because I don't know how others are going to take this.
Yes.
And to your point, I'm just so tired from fighting and
Yeah.
from all these challenges. I don't even want to say anything because that puts added pressure and added stress on me.
Yeah.
And something that I say to a lot of people that they have this mentality is, do you think about it in this way? Short-term pain for long-term gain versus more longer-term pain and short-term gain.
Yeah. Yeah.
And a lot of times that's where we're at is with the latter. I am going to be content because I feel comfortable and feel safe here right
Mm.
now. And I don't even want to say safe. I feel comfortable. I feel familiar with this.
Yeah.
But later on down the line, it doesn't get any better.
Yeah.
And so we have to, I think as professionals, we have to foster a space like we can be that person, that organization, that system that helps people to feel that safe, helps people to
Mhm.
feel like they can advocate. So as a clinician, I am constantly leaving things open for people to be
Mhm.
able to say, hey, this is not working. And when they do bring something up to me, thank you so much for saying that. This was
Yeah.
helpful. How
Yeah.
can we change this? What can we do to change this? So that they can build that confidence in self advocacy to be able to start saying that to other people. And sometimes that's a lesson that I do with people, just to see how can we make sure, not just here in this space that we're in right now,
Yeah.
but with a family member, with this doctor, with friends, that I'm self advocating and saying things so that I'm not feeling let down, or left out, or anything like that.
And our present healthcare system is so broken that seniors are ignored
Mm,
across the board. That actually adds to the issues that if you're
yeah.
already feeling like you're marginalized and discounted
Yes.
and dismissed, you take that personally, when a lot of times it's just we have a screwed up healthcare system right now
Mm,
that is just harmful.
yeah.
You have a podcast, Let's Talk Solutions. Is that
So it's called Conversations and Reflections with Dr. KSB.
okay?
So that is, so I actually have two podcasts, one that I do
Okay.
personally, and
Uh-huh.
then one that I do with the school that I work for, the university that I work for. So the one that I do personally is Conversations and Reflections with Dr. KSB. And that is where I talk about anything that is relevant to self-reflection, things that are going on. The first couple episodes are really just thinking about, yeah, how I've come to where I am, and really throwing some things out there around reflection. And then the other one, the one that I do for the university, that is called Empower Hour Social Work Stories. And that is, I bring on guests that are usually social workers, but I'm also
Mhm.
looking at people who have lived experience in different aspects that can talk to what they do. And especially when if it's a social worker, what can social workers do in the profession, and really talking about and giving that aspect to students, future social workers, current individuals that really want to get into the profession.
I find social work to be very hard because the resources are so limited out there
Mhm.
and the needs are so great. And
Yeah.
I did discharge planning and care management,
Mhm.
the disparities with those that didn't have health care insurance and those on Medicaid, and it just shocked me. I learned a lot over my 54 years about things like that, the disparities, the marginalized
Yeah.
underneath, and the challenges we face as a culture on providing
Mhm.
care that's needed. What steps can healthcare providers, policymakers, or even caregivers take to make aging more equitable and affirming for the LGBTQIA plus community?
I think the biggest thing is going to be education. Educating yourselves, getting information about the LGBTQI plus aging population. What are the types of things that a person within that community may experience? What are things that I need to look out for? What are the barriers that come up? What's the history behind maybe the mistrust in the health system, or even just different systems that people are in? That's going to be so important, especially when it comes to caregivers and healthcare providers, or just providers generally, mental health, physical health, all of that. For policymakers, I think it's listening to people, listening to the stories that people are telling,
Yeah.
listening to again, the history,
Yeah.
looking at the history and saying, what does this, if I'm trying to put this policy through, and it may particularly have to deal with the LGBTQI plus population generally, older
Uh-huh.
adults generally, or those intersections of different identities.
Mhm.
How does this look? What does this look like from in the past? Is this something that would add levels of discrimination, stigma, levels of ageism,
Mhm.
sexism, heterosexism, all those sort of things? listening to those stories of what people have experienced so that they can use that emotion to, I don't want to say make a decision because we don't want to make decisions on emotions,
Right.
but listening to what those stories are and understanding that, as I said earlier, people in this population are humans as well.
Yeah. I think that's the way I approach every client or patient I've ever had. I didn't care what color you were. I didn't care what religion you were. I was looking at you with fresh eyes, and I feel that anybody who comes into my life, even for it's a brief moment at a grocery store, people have something to share or offer
Yes.
me if I take
Yes.
the time to look. And
Exactly.
I see we have a lot of closed-minded people, or I will say religious zealots sometimes, that miss the point that God makes everybody, and he made this person however they are, and they have different lived experiences
Mhm.
from us. And I think people discount those lived experiences a lot,
Yep.
and they make us who we are.
Yes. Those
They make
stories are and that's what makes up the history of
Yep.
the different populations, society as a whole, the world generally. Those stories are what makes us who we are.
Yeah. I look back at my friends Rose and Joyce, both are passed now. Rose was an Italian, and her family disowned her. And Joyce's family was more accepting, but they had all died. So when they both got ill, it broke my heart because they didn't have the support. Now, what they did have was a lot of good friends.
Yeah.
All in a greyhound community. We all had greyhounds. So
Nice.
yeah, and we had many things in common, and we did things together as friends. So when they were going through their death and dying and decline, they were well supported by neighbors and what do you call it? Chosen family?
The chosen family.
I love that because we can't pick our family that we're our biological family, but we sure can pick other people in our lives. And I find that makes our lives interesting. And I think we just need to all get back to being basic human kindness to people, anybody, no matter who they are, where they're from. It's just, and I think that we've lost that in our culture, our
Absolutely.
society.
Absolutely. Absolutely. Yeah.
LaRon, for listeners who want to be better allies, what's one action they can take today to support the LGBTQIA plus elders in their communities?
I'm going to go back to the education.
Yeah, I agree. I
I'm going
agree.
to go back to that education. I think like if you know there's someone in education and approaching someone, talking with someone. If you know someone is LGBTQI plus in your community,
Yeah.
elder or youth, anyone, try to have a conversation with them. Bridge that gap between what's going on and where you are. Have conversations with people. That basic human, not competency, basic human kindness
Yes. Yeah.
is going to be so important.
One of the things that I love as being a nurse is I love learning about people. And
Yes.
one of the sad parts about our healthcare system now is nurses aren't able to do that. They're in, they're out, and they're not getting to know or even taking time to learn about a person. So I think making judgments about a person is
Yes.
so much easier because they're not humanized to the person. And I never let that happen. I don't care. You could be the crotchiest old crankiest old man on the unit, and I'm sure I was the one that was going to get you. And I was going to find something positive about that experience that I had
Yeah.
to. Yeah.
And that's a bit that being open-minded as well.
Yes, I agree.
Open your mind to these new experiences.
How do my listeners find you?
So you can find me on LinkedIn, KaRon Spriggs-Bethea. You can find me there. You can also look at my website, letstalksolutions.org. You can also check out the podcast anywhere you listen to your podcast.
I create a permanent page on my site with connections, and all your content or your links to all that will be at the bottom of the page as well as in our show notes.
Sounds good.
To my family caregivers out there, you are the most important part of the caregiving equation. Without you, it all falls apart. So please learn to be gentle with yourself, practice self care every day because you are worth it.